Welcome to Prescribed by Dr. Nathan Goodyear, where integrative oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now.
Welcome to the Prescribed Podcast. I'm Dr. Nathan Goodyear, your host, and we got a little bit of a seasonal ring to this podcast, if you will. It is holiday season. It is Christmas time. Of course, I'm in Arizona. You wouldn't know it because it's 80 degrees today and sunny. So I'm not going to brag about it, but I will. But, in this time of the holiday season, Christmas time, what does a podcast, what is a doctor that talks about integrative medicine, health, wellness, and integrative cancer, oncology? What might I talk about that is related to this season? Good question. But the answer is so obvious. It's mistletoe. Mistletoe. Now, when we think about Christmas time, we think about mistletoe as it relates to stealing a kiss at a Christmas party. And in fact, when you look at the history of this, it goes way back. It's really quite interesting. Now, try to do that today, and you might get yourself in a little bit of trouble. But, when we look at mistletoe, excuse me, I'm getting over a cold. But when we look at mistletoe, it also has intense medicinal value. And if we look at some of my favorite Christmas songs, Dean Martin said, "Hey, baby, it's cold outside, but we've got mistletoe." So he's implying here, Dean Martin is, as he sings it much better than I could even say it, that mistletoe is instilling a warmth when it's cold outside. So I am bringing on one of my dearest friends and former colleague, though I still call her a colleague. She, I'll just let her introduce herself. Dr. LaBant, Miranda LaBant, welcome to the Prescribed by Dr. Nathan Goodyear podcast.
Hello, thank you. I think you passed your little cold over here, even though I don't have one. Excuse me. It's a pleasure.
So a digital virus. We just kind of passed it through the computer.
Yeah, it's a pleasure to be on today and talking about one of my absolute favorite integrative cancer therapies, talking about mistletoe. I think it's such a great topic for the season, but usually when I'm engaging with patients and introducing this therapy to them, it's really met with skepticism and sometimes this curiosity, like, what is this treatment you have to offer, Dr. LaBant? So I'm really excited to dive into this with you today.
Yeah, and I want to do some deep dives in it because I think, what I've learned from the vitamin C debate, which has been ongoing for decades, back to Linus Pauling and through the Mayo studies and so on and so forth, is that what happens in these integrative or more natural therapies, as they start to make their way into the consciousness of conventional medicine, is the people that are designing the studies, that are analyzing the studies, that are using the therapies, they don't understand them. And so I don't think intentionally, maybe they do, but unintentionally, they design studies that actually are going to fail because they're not appropriately utilizing these therapies. So, and I think what's important here, what's relevant for our listeners here is your experience. See, Dr. LaBant and I worked together for almost 2 years at an integrative oncology clinic. We had patients come in from really all over the country, sometimes out of the country, and we developed a very close relationship. And there were numerous doctors there, and there was no doctor that I trusted as the medical director more than her. I knew if I had to step out that her ability to lead the clinic, both from a natural, holistic, and integrative perspective, and even from a conventional perspective, she had all the skills to do that. So I think what's relevant to this discussion, because of course I come from the medical doctor background, the MD and the MD homeopath, Dr. LaBant, your journey took a different. So because of that, I think it's relevant to this discussion. Why don't you give us a little insight to the listeners?
Mm-hmm. Well, as a naturopathic physician, there's not a lot of understanding that you can specialize in different areas of medicine, right? Much like a conventional physician, you do a residency and then a fellowship, and then you specialize. And within the realm of naturopathic medicine, there are residencies available and specialties available. And I found myself at the end of my training moving towards integrative oncology. I completed a integrative oncology residency in Hawaii. I know, difficult place to complete a residency. Terrible. And I was introduced to mistletoe and all of these incredible therapies that I'm sure you and I could banter on about and dive through the research on a regular basis. But in my training, when I first started learning about mistletoe, I understood that it was not just an herbal medicine, but had so much research behind it. At the time had close to 3,000 publications. And I think it's so misunderstood about mistletoe that it's this, it's an herbal medicine, but it's really one of the heaviest research bases that we have as an integrative cancer therapy. I heard recently on a podcast that there's now close to 7,000 research publications on mistletoe therapy, or more extensively on Viscum album extract, which is really the European mistletoe. And I started integrating this into my practice and IV therapy and subcutaneous injections, and started seeing improved outcomes with patients. So that was back in not too long ago, but 2017, when I started utilizing mistletoe in my practice. And I think you and I can dive into some of the clinical applications there of how it can improve the patient's quality of life and overall survival outcomes, responses to conventional treatment. And so this particular therapy has an incredibly profound impact on the outcomes of patients from a integrative perspective.
Now, mistletoe falls into the category of a folk medicine. And so, a folk medicine, it's really interesting. I was doing some research on it last night. Folk medicine is really something that goes back to three characteristics. It has cultural and historical roots. I mean, some of these go back thousands and thousands of years. And in fact, when you look at mistletoe, some of the earliest writings go back to the time of the Druids. Okay. The Druids, we're talking over 2,000 years ago. Okay. So a long time ago. And then in that, this gets passed down typically through oral tradition, much of this. We might, call this today an old wives' tale or something like that. But, now being 54, goodness gracious, can't believe I'm saying that. So many of these old wives' tales, they have wise value to them, which is really interesting. So leave it to mom to provide wisdom to the household. Nobody should ever doubt that. And then they're always natural ingredients. Okay. So it's those three characteristics that really, wrap up what is a folk remedy. Now, during your training, Dr. LaBant, did you ever look at mistletoe as a folk remedy? Was it presented that way, or was it just presented as a therapeutic that came from a parasitic plant?
Well, I being a naturopathic physician, I understood it more as a folk medicine. You're speaking to the acceptance through the Druids and the understanding that it was used as a longevity and fertility plant because of how mistletoe grows. So yes, it is a semi-parasitic plant, and it's very bizarre actually where it grows and how it grows, and it makes its presence known in the winter months when the rest of the trees are all the leaves are falling off and going into hibernation. It's in Roman and Nordic and Norse, Greek mythology. And you see this remedy, classically used for epilepsy, calming the nervous system. Actually, in the U.S., it is, recognized as a homeopathic remedy for headaches, oral use only, which is very interesting. So there are a lot of different applications throughout time, but it wasn't until about 100 years ago now, that it was recognized as a therapeutic for integrative cancer, thanks to Dr. Why can't I think of
Rudolf
her name
Steiner.
right now? Rudolf Steiner
Rudolf
and
Steiner.
Ido Wegman.
Yeah. Ido Wegman. Yeah. Yeah. So that's okay. Sometimes when I'm walking through, it's like, okay, oh, notes. Yeah, there you go. There you go.
Yeah. Who
So
is it?
because she's much younger than me, obviously. And, at 54, sometimes the memory goes, wait, where did it go? Where did it go? But which way did it go? Which way did it go?
Yeah.
So, but
But
here's an interesting point. Oh, no, go ahead and finish.
yeah, I guess I didn't really answer your question. It wasn't really introduced to me as a folk medicine. It was presented as this is an evidence-based, therapy that we can include for our patients. And so I understood it as that, but obviously being the curious doctor that I am, I had to look into some research. And, Dr. Nisha Winters, has also put together an incredible, resource, not only for practitioners, but for patients, and in really going through the history of mistletoe and the timeline and really understanding its mechanisms. I think it's an incredible read for anyone that's interested in understanding more about mistletoe. So I picked up a copy of that myself and, started really understanding more about it.
And when you look at mistletoe, not necessarily as a folk remedy, but if you just look at it as a therapeutic, you have to look at the predominance of the evidence. Mm-hmm. And see that early on, the evidence was obviously there was a lot of anecdotal, there was observational, and as we've gotten into the more, what you might call the conventional scientific arena where, they're focusing on the gold standard of the, double-blinded randomized placebo-controlled trial. Though, as I always say, where's the double-blinded randomized placebo-controlled trial that shows that the double-blinded randomized placebo-controlled trial is the best form of therapy, study analysis. So, but we started to get into in vitro, in vivo, and then clinical research. And early on, so much of the research was obviously in vitro, in vivo, and observational case studies, case series. Mm-hmm. But now we're actually starting to see that move into the clinical research. So I'm super excited about that. But at the same time, I am a little concerned about it because of the history of vitamin C and how it was, I think, misappropriately applied in studies. And that set us back a little bit, but maybe we can learn from that. And people like you and obviously people like Nisha Winters can help make sure that we don't make those same mistakes. But I think one of the things when people look at mistletoe, they know of one context of mistletoe in their mind, and that's Christmas time. And that's why I'm doing this short series during this time of year, because I want to expand people's mind as it relates to mistletoe and create that and feed that curiosity in mind that we so desperately need today. But I think people think that there's one type of mistletoe. And I think that that's where people get drastically confused, but there are actually many types of mistletoe. So, for example, there's European mistletoe, Viscum album, which you mentioned. There's American mistletoe, dwarf mistletoe, Australian mistletoe. So I'd love for you to touch on that because I think when people think mistletoe, they're thinking one type, but there are so many different types of mistletoe.
Well, there are actually close to 1,200 different species of mistletoe. But really where the research focuses and the application of mistletoe in the use of integrative cancer care really lies in what I had mentioned earlier about European mistletoe or Viscum album extract. And so, yes, there are a lot of different varieties, but typically in clinical practice, we use more of the Viscum species or the Abnoviscum species. And so, in choosing treatment for patients, and that sometimes gets confusing because it's like, how do you choose what particular therapy? And mistletoe is more of an anthroposophic medicine. Anthroposophic medicine, interestingly, was founded by medical doctors who were classically trained and then had a more holistic approach to understanding the human body and applying science, and also more of this spiritual practice and understanding that you need to treat the body as a whole. So I think that is pretty fascinating. And there still are true anthroposophic practitioners today. But in understanding that particular piece, with anthroposophic medicine, there are, in a sense, it sounds a little woo-woo, but essences to these therapies, right? Body types that you can apply to a particular patient. For example, Viscum molly comes from the apple tree mistletoe. And for these patients, from an anthroposophic perspective, they tend to be a little bit more stocky, maybe less physically fit, a little more sluggish. And then we have Viscum peony. Those patients tend to be a little bit more slender, a little bit more athletic build. And so you can use these pieces to help choose. But as research has gone on, and studying particular forms of mistletoe, we have found that there are applications for different types that are more specific to a cancer type in particular. For example, like Abnoviscum fraxini, which tends to be a more profound fever induction therapy, is generally used in more either rare or pretty advanced cancers when there's bone metastasis involved, or I think of sarcomas pretty frequently when we're talking about that.
Cool.
So there are different species, but really there's only 4 that are well studied in the realm of its use for integrative cancer care. And that's really, where I make the decisions in regards to choosing them for patients. So Viscum album, Viscum abies, Viscum molly, Viscum pini, and Abnoviscum fraxini.
Yeah, and I think some of that may have to do with our access here in the United States. Obviously, there's limited access because I think when you look outside the U.S., particularly in Europe, where it's really interesting when you look at mistletoe as a therapeutic, its efficacy and the science seems to be bounded by the boundaries of countries. I've never found that actually making sense, because science should overstep boundaries. It should basically transverse any type of boundary created by country or union. But we seem to have a difference of opinion and a lack of acceptance here in the U.S. by the conventional medical community. Could you touch on that?
Yeah, it's actually used in Germany as part of an adjunct to the standard of care. It's if someone's diagnosed with cancer, they go in for treatment, and they're using mistletoe intravenously, intratumorally, subcutaneously to support patients through their therapy. It's used widely in Asia, Africa. In the U.S., it still has not found its way, through with the acceptance fully. Interestingly, we were talking about research, but in 2021 was the first phase 1 clinical trial through Johns Hopkins University, where they were looking at the safety of mistletoe, and phase 1 trials are obviously looking at safety and dosing and such before it can kind of move on to higher phases for those that aren't privy to that. But so it's widely accepted in Europe and in Asia and other countries, but unfortunately not here in the U.S.
And by conventional oncology, mind you. So this is not like it's, there's oncology and then there's some, alternative doctor, quote unquote, as we use here in the U.S. to simply marginalize people, right? Let's be honest, that's what that term means. And so it is in the mainstream, action for patients. And so it's accepted as a combinatory therapy. And that brings up a good point, because I think that's kind of where you and I meshed when we were together, here in Scottsdale, working together as a team. Of course, there were other valuable parts of the team, but, I think that our different backgrounds, but yet our singular focus, it provided a synergy, and that synergy provided a, exponential benefit to the patients that came our way. It's not an additive 1 + 1 = 2, but a synergism is providing a 1 + 1 = 10. And so when you look at mistletoe, it's kind of like that way too. There will be people that will use mistletoe. You recognize this, Dr. Miranda, alone. They'll have advanced cancer and they'll use sub-Q mistletoe, and that's all they're doing. But really where it shines is when it's used in conjunction, in synergism with other therapies. And that's where it provides that exponential benefit.
Yeah. And that's where the bulk of the research, really lays with mistletoe, is its use to support not only the outcomes of chemotherapy and radiation as an adjunct, but to improve the quality of life in patients. So reducing the fatigue levels, improving appetite, really tonifying the system as a whole. But mistletoe really is understood as a immunomodulator. It's immunotherapy.
Well,
When we think about immunotherapy, we think of these modern medications that are, supposed to be cutting edge, and they are. I'm not saying that they aren't, but immunotherapy was really understood hundreds of years ago, right? We just didn't accept it as that and didn't have the evidence to do that. Now we have some incredible cutting edge immunotherapy treatments, but I think it's important to understand the concept of what immunotherapy is. We think of it as a pill, right? But really it's anything that is stimulating the immune system, creating warmth within the body, stimulating a fever response, right? When we have a fever, it's typically pretty uncomfortable, but that's really our body's innate built-in form of immunotherapy to bring in acute phase reactants, right? These immune cells, natural killer cells, neutrophils, all of these big pillars of our immune system that help us to fight pathogens, bacteria, viruses, and ultimately cancer cells, right? And that's what these we haven't really gotten into the mechanisms here, but mistletoe has lectins and viscotoxins. Mm-hmm. And so I think we're just
we'll get there.
Kind of speaking about the synergy of this, and it actually brings to mind a really fantastic trial that was done out of Germany in 2023, where they had advanced pancreatic cancer patients. It wasn't a huge trial; it was around like 120 patients, I believe, and they compared mistletoe with hyperthermia and chemotherapy. So the groups was chemotherapy alone, chemotherapy with mistletoe, and then chemotherapy with mistletoe and hyperthermia. And in the outcomes of that, and I think this study really shows the synergy of how mistletoe can improve outcomes. So in the chemotherapy alone group, so talking about FOLFOX, gemcitabine, some more kind of salvage chemotherapies for pancreatic cancer, the overall survival was 8 months. When they added in the mistletoe to the chemotherapy, 12 months overall survival. When they added in chemotherapy with mistletoe with hyperthermia, 19 months overall survival in response to treatment. And I think that's a really, it's a small trial, but I think it's a really beautiful depiction of the power of not only mistletoe, but immunotherapy and combining conventional treatment with natural therapies.
Yeah, anything, and immunotherapy implies it's a good benefit, but I would actually say sometimes a therapy can have a detriment to the immune system. Of course, chemotherapy can definitely do that. In a very short term, low dose chemo can actually have an immunomodulatory effect. But, if you're doing low dose chemo and you're doing it weekly for, 30 weeks, it's going to have the same impact that full dose chemo will. Mm-hmm. So don't think that even though it's low dose, you're doing it week after week after week after week after week and so on, that it's not going to eventually have the same toxic effect to your immune system, because it will. It will. And I think that's a great point that you bring up. That is over a doubling of overall survival benefit. That's amazing. I was just reading a study looking at a new therapeutic coming to pancreatic cancer, and they were getting all giddy and excited because it provided just under 2 months increase in overall survival. Mm-hmm. And here you're talking about the addition of mistletoe and the addition of hyperthermia to chemo, and you're doubling it. So it really puts in context, I think, how powerful these natural therapies, folk remedies, can be as adjuncts. We just got to change I think we got to change the consciousness of the North American public and medicine as a whole that, look, these are helpful therapies to you, and they help your patients, they help your therapies, and they help their quality of life. Mm-hmm. It's really interesting because, you talked about warmth. And when you read, text on mistletoe, they talk about warmth. And in that Dean Martin song, Baby It's Cold Outside, he references the warmth of mistletoe, not specifically, but hey, we got mistletoe because it's warmth, so I find that really interesting without them understanding that what they were describing is exactly what you were describing as the immunotherapy benefit of mistletoe. So just as we described that there's not just one type of mistletoe, and you mentioned the lectins and the viscotoxins. That's where I love to be, because, obviously I want to focus more on that immunostimulating impact and maybe even cytotoxic effect of mistletoe. But there's 4 different extraction types. So there's different types of mistletoe, but there's different extraction types. And what I'm trying to do here is help people to understand the complexity. Because somebody say, well, I tried mistletoe and it just didn't work. Well, what type of mistletoe? And how was it being administered? How often was it being administered? How was it extracted? What was the purpose of it? So all of these play into, well, I just tried the mistletoe and it didn't work. Okay. Let's dive into why. Maybe it didn't work is because you were given the wrong therapy. So can you touch on the 4 different types of extraction methods of how this is extracted from the plant?
I don't know if that's really if I understand that all fully, since I'm not a pharmacist or a chemist, but I do understand the components and how those are extracted and what, maybe you could speak to that a bit more, but as far as the constituents.
Yeah, my fault. Yeah, my fault. I didn't mean to put you on the spot, but this is again I just go deep into stuff because we always, and Miranda's just like this. We want to lead with the science. We don't we don't lead with our bias. We follow the science. And typically when you do that, you kind of go down, these rabbit holes, and it really empowers you with knowledge. So the primary 4 techniques is the Iscador method. And the Iscador method, we don't really have available here in the U.S. It's something you'll see more prominently out in Europe and other areas, but it's a fermented form. They use, bacteria, lactic acid bacteria to actually extract the mistletoe. You have, as Dr. Miranda mentioned, two of us, our favorite, the abnoviscum, technique here. And it's a cold extraction. The reason why you want that cold extraction instead of the fermentation is it preserves more of those, very potent, proteins, those lectins and viscotoxins that Dr. LaBant mentioned. And those are very important in either immunostimulating or direct cytotoxic activity. And so Dr. LaBant mentioned that fever induction therapy, you can actually induce fever with forms of mistletoe. Other forms, you cannot. Then there is the viscum method. The viscum and the abnoba are the 2 primary, mistletoe type extractions you can get here in the U.S. And this one provides more of it's an aqueous extraction. It provides more of a balanced, mix of these lectins, and viscotoxins. So it's really focusing on the purity. And so it's going to be strong, but maybe not as strong as that cold extraction with the abnoba. And then there's the helixor, and the helixor is a cold maceration process, again, creating more of a balanced extraction. So again, not meaning to put you on the spot there, Dr. LaBant, but so when we think about mistletoes, people will say, I got Abnoviscum fraxini. I had Viscum molly, Viscum pini. So now when you hear those words, you go, that's referring to the extraction method. And via the extraction method, guess what you're getting? You're getting a different mix. And so that in turn could have been why a therapy did or did not work. So when you talked about Abnoviscum fraxini, Dr. LaBant, and the fever induction therapy, that is a powerful pop because of the lectins and the viscotoxins.
Yeah, it has 4 times the concentration in the process that you're describing for the extraction method that I'm not so privy to explaining. But when I describe this therapy to patients, I focus on so they understand the mechanism. I like to educate patients on what these treatments are doing and why. And lectins, I know you're a word guy, but lectin means to select, to elect, to choose, right? And lectins ultimately help to induce apoptosis. They bind to these carbohydrate structures, which we know are associated with cancer cells, and help to induce that apoptosis and cell death. And so I think that's important to understand, what is that mechanism? It's not just mistletoe. It's not just some Christmas kissing herb that we have. There is true constituents and science behind why these therapies work and what their mechanisms are.
Yeah. And that's where I get to where, and you're seeing this with mistletoe, where people are stepping into using it in research or using it in clinical practice, yet I don't think they understand the complexity. And that's why I wanted to bring you in here, is to provide the layers of complexity, because we're about to get into the different mechanisms of action. but it's those layers of complexity that I think aren't a negative. They're actually a positive because they show the broad impact of how mistletoe can be used appropriately. And so from that kind of homeopathic background, that naturalistic background, doctors, we look at things and medical doctors, we look at things from a very different perspective because that's how we're trained to think. And so taking that framework of thinking and applying it to, natural holistic therapies like mistletoe or IV vitamin C, sometimes that results, not sometimes, many times, that results in a misapplication of those therapies and thus, therapies that just aren't going to work. And so it's good to see that we're actually starting to get into what I hope are some good studies and some good evidence to support the proper use of this. So, you talked about the anti-cancer benefits there of, mistletoe. So you mentioned apoptosis. Beyond that, what's one of your favorite, effects? What are you thinking about when you target with mistletoe? What are you doing?
Yeah, well, and so, I mean, I think it's important for anyone who's really learning about mistletoe to understand the kind of the broad mechanisms, and then we can talk more about what you and I like to talk about, the science. And so the main mechanisms are really immunomodulation, bringing the immune system kind of into focus. Although I was talking about these kind of immune cells, these white blood cells, natural killer cells, T and B lymphocytes, and stimulating the immune system to not only target, but tag abnormal cells to be recognized by the immune system for destruction or cell death, apoptosis, whatever that may be. We also have this immunoprotective effect. And I think you're asking what my favorite mechanism is. I think this is pretty incredible because it has the ability to stabilize DNA. Cancer cells have very abnormal DNA structures, right? And it can help reverse that process. It has neuroendocrine effects. So we see this across the literature when it comes to improving quality of life for patients, helping to decrease fatigue levels, right? And you see that especially used as an adjunct with the standard of care. And then we have the tumor inhibition, which I think is probably the most less understood about it. We see it more as an immunomodulator, immunostimulant, but it has, when you look at the mechanisms with the viscotoxins and the lectins, it has this direct tumor inhibition. And you and I can go into those mechanisms a little bit more, but I think just speaking to them a little bit more plainly and understanding kind of the broader effects of mistletoe.
Yeah, what are called the hallmarks of cancer. And that's very good because it's something that's a little bit more tangible than us talking about, stimulating a particular, pathway, signaling pathway within the cancer. That's where you and I like to geek out. And it helps because it helps us to target mistletoe. But it's something that, as you mentioned, our job is, and I think you eloquently said that, our job is to teach patients. It's to empower them. And when they're empowered with knowledge, they're empowered to steer their health care the way they want it to. And so I think you eloquently said that. Yeah. So when you look at this, and we're in this kind of arena of precision cancer care, which is the right treatment for the right patient at the right time, which is thankfully it is a switch from the, one size fits all approach therapy strategy that has been the conventional paradigm, the dogma for the last 100 years. And a lot of people don't look at mistletoe that way, but I think mistletoe does actually really dive into some of this, arena of multi-omics. And you already mentioned one aspect, and that's the stabilization of the DNA. So it's already working there in genomics. We know it works in transcriptomics. We know it works in proteomics. And we know it works in, immunomodulatics. So it's really diving into, as a natural therapy, into that arena of precision cancer care. But when conventional doctors look at it, they look at it as just some natural woo-woo therapy, right? Oh yeah, you take that mistletoe. I don't want to hear about it, but hope it steals you a kiss. I actually had a patient tell me that her oncologist told her that. But but I think that hinders the growth and has hindered the acceptance here in the U.S.
Mm-hmm. Yeah. And you're speaking about the hallmarks of cancer, which have only expanded over the years and in the recent years, understanding these different mechanisms. And mistletoe touches on almost every single one of those. It helps to induce TP53 expression, right? Tumor suppressor genes, helping to upregulate that. How incredible. It downregulates COX-2. That helps to reduce cell migration. So stabilizing disease, reducing inflammation. And I'm not just making this up. There's mountains of research about all of these different mechanisms. It helps to inhibit or reduce VEGF, vascular endothelial growth factor. That stimulates angiogenesis. Cancer cells have this incredibly invasive ability to create their own blood supply. So why aren't we using more therapies like this when we have the evidence to support not just the improved quality of life, but really these tumor inhibiting mechanisms?
Well, because I think you displayed it in your precision discussion there. Thank you for that very much. COX-2. I love that. That is an inflammatory. It leads to invasion and progression and metastasis. I mean, this is why I love Dr. LaBant. She's a dear, dear friend, and, her significant other, in the background there. I won't mention his name, but he's a dear friend as well. And, they're just great people, but she comes from a natural perspective, but she dives deep into the science. And I love that. And the vascular endothelial growth factor, conventional oncologists, they don't think this way. They think about, well, what's the standard of care? So what am I taught to do? Okay, I have stage 4 pancreatic cancer. We haven't had chemo. It's non-resectable. So we can't do a Whipple. So we're going to start off with FOLFIRINOX. Okay. Is there a process of thinking related to that? Looking at the hallmarks of cancer? No. They're repeating a protocol. That's being honest. You may not like to hear that, but that's exactly the way the standard of care is structured. And I know Dr. LaBant's not saying that. I am, but I'm a medical doctor, so I can say that. But when you look at, hey, vascular endothelial growth factor, it's present. Well, then the question is, well, why then doctors are not testing for that? I don't know. But if you can test for it, shouldn't you? Well, what if insurance doesn't cover it? Insurance doesn't guide science. It doesn't guide the practice of medicine for patients. The doctor and the patient do. So the doctor should say, look, I'm concerned about the expression of angiogenesis factor. Let me check vascular endothelial growth factor. Oh my goodness, there it is. It's elevated. Let me target it. And you can target it with mistletoe. See, versus when you look at the conventional oncology, what are they doing? Oh, protocols. Well, guess what? We can target that will help their protocols work better. So it's not to burn a bridge, but it's to build the bridge. But I also think we have to call out where, we get stuck into this groupthink, this protocolology, if you will, and we need to change the way we think. And I think this movement in integrative oncology is really helping that. But I want to talk about the cytotoxic effects because, right now I work with the Williams Cancer Institute. I love what I do. It's an amazing team. And I want to talk about the different delivery methods with you. But, what I always tell patients, Dr. LaBant, is the best answer to cancer is never get it, clearly. And the best answer to cancer beyond that, it's the immune system. And what mistletoe does within that immune system. So for example, with the natural killer cells and what it does with the T lymphocytes, it is super, super exciting how it can be used with what we're doing in the Williams Cancer Institute, which is an intratumoral approach. Love to hear your take on that.
First of all, I love that you're talking about the intratumoral approach, but especially with mistletoe, I think there's a huge place for it. It's more understood as a less invasive therapy, doing it subcutaneously. That's really where the first research kind of started with it back in 1917, to be exact. Dr. Wegman started doing subcutaneous injections. I think it wasn't until the 1950s where they did their first successful intratumoral injections and had incredible responses. And so I think that there's a big playing field for intratumoral therapy, not just with conventional immunotherapies, which is, I think, a lot of, what's more understood, but using therapies like mistletoe intratumorally as an adjunct to therapy or even as a monotherapy. There is research for that.
Yeah. And, that's where I'm super excited is, taking the fight. And I hate to use that verbiage, but I think people understand it because it provides a war context. And we know that when you go to war on cancer, basically you end up turning the body into a battlefield. And it's that systemic to tumor approach. But by going directly to the tumor, and there's actually research where they've done that in Germany, where they've done intratumoral abdoviscum praxini and viscum album and in pancreatic cancer, in conjunction with conventional chemotherapy. And they've actually seen a survival benefit. So, so the precedence is there in the research. The phase 1 studies have shown that, mistletoe is safe. But I want to kind of wrap up this great conversation. So thank you for your insight. As always, you never disappoint. People look at mistletoe and they think just as there's different types, as there's different extraction types, there's different effects, and we've touched on many of them. I mean, it even decreases epithelial to mesenchymal transition. It's that mechanism that cancer goes from immobile to mobile, how it spreads. And the reason why that's important is 90% of morbidity and mortality is when cancer spreads. So we need to stop that process preemptively, not after the fact, which, by the way, chemo does spread cancer. So that's why I think it would be well to use it in conjunction as an adjunct here. But there's different techniques of delivery. So I'd love you to touch on those and maybe provide some clinical pearls about where these, therapeutic delivery methods, these different modalities can be used more appropriately. Because this is where I think conventional medicine is misapplying mistletoe.
Mm-hmm. So, there are 3 standard delivery methods of mistletoe. I think we've talked about it a little bit through our conversation here. I think the most common delivery method is subcutaneously. And so these are just injections that are given right under the dermis into the tissue of the patient. And these can be done in a more consecutive delivery method. So it's something that the patient can easily do, be trained to do on their own. And I think it's very helpful in having this chronic stimulation of the immune system and also supporting patients' outcomes with therapy. So that's a bit more readily available to patients. I think the next tier of delivery is intravenously. And, this is really where I started on using mistletoe in practice, was using it as an adjunct to other IV therapies and synergy with other treatments. And so intravenous application, you're getting a more kind of intense sort of systemic or cytotoxic approach. And there was some studies actually in more observational studies in 2016 that looked at the application and the safety of intravenous mistletoe. And they really found what all of the research is applying or alluding to. Improved quality of life in patients, improved response to the standard of care, long-term disease stabilization. It's also, when we use mistletoe as a subcutaneous injection, we're actually looking for these specific reactions within the tissue, letting us know that the immune system has been stimulated. Sometimes that's a small red circle in the area of the injection. There could be some tingling or itching. Sometimes patients, even with the lower lectin levels, they can induce fevers. I actually had a patient email me the other day. He developed a really nice fever response, and he's like, "This is uncomfortable." And I told the patient, "Well, this is actually what we're going for, right? We want this immune stimulation." So you can induce fevers. It's an individualized therapy, and I think that's something that's also really important to understand about the application of mistletoe, is that it's not this set protocol. And I think that's something that the standard of care also has a problem with. It's an individualized treatment. And we're also applying lab work to see the response of patients, right? Making sure we're not causing any detriment. You mentioned, sometimes immunotherapy sometimes we see pseudo progression in patients. Sometimes it causes a pretty intense inflammatory response. And so a well-trained provider in mistletoe is looking not just at how the patient is responding with subcutaneous injections or IV application, but what are their labs telling us? What is the objective data showing us? Are we seeing kind of this inflammatory response with CRP going up and LDH? Are we seeing tumor lysis on labs where uric acid's going through the roof? And, we're looking at all of that. We're looking at the, Nisha Winters talks a lot about the neutrophil to lymphocyte ratio. And I do agree with that. We can see the immune system sort of flip, and, we don't want to be creating any additional harm in patients. So, with these therapies, I think I'm rambling a little bit, but with these treatments,
No.
my whole
Sure.
point is that we're not just applying them willy-nilly. We're applying them in a precise fashion and assessing the patient along the way with that response to therapy. And so I think with those two applications is really where I'm more comfortable with. But the third application is really intratumoral. And I would love to be doing this, but I think it's just not widely accepted at all. In the US at this point. It is, in Europe and I'm sure, other countries as well. And I think that's really where we should be heading with the application of mistletoe is, studying this therapy more as an intratumoral, immunotherapy, treatment. I've also used it in clinical practice more intravesically with bladder cancer. There's some wonderful research on advanced recalcitrant recurrent bladder cancer. We know how quickly that can recur even with standard of care options. I know we don't have all the time to go into all the research. I would love to do a podcast on just mistletoe research. It's pretty fun to dive into. But with bladder cancer, they've studied just intravesical Amnovisum fraxini and have seen it I guess perform better than the standard of care. BCG and helping to improve outcomes and reduce recurrence rates for patients. So we have, intravesical application as well. Not so much orally in the use of, integrative cancer care. It's really not bioavailable in that sense, but from a, folk medicine anthroposophic perspective, there are other applications in that sense, but I don't use that application in clinical practice.
Well, I think the future is intratumoral, and I think you're starting to see others understand that. Of course, what we're doing at the Williams Cancer Institute is we're doing everything intratumorally, and so I'm super excited to look to bring these therapeutics into that perspective, and actually bring it into the perspective also for publication and advancement, and that's where I think there can be international collaboration. But you can see that stepping stone of mistletoe, sub-Q, IV, and intratumoral. And there was a recent study that was looking, it was actually out of Germany, interestingly enough, but they were looking at stage 4 pancreatic cancer. These patients were on palliative chemotherapy, and they only gave them sub-Q mistletoe. And they go, well, we didn't see a survival benefit. And I was like, well, yeah, I could have told you that before you even did it. Now the quality of life measures, there was some positive, some maybe not so positive, some negative. So it was kind of a wash. But in that kind of disease burden, that advancement of disease, you're going to have to be more aggressive. And that's where the different types of mistletoe, the different extractions of mistletoe, the different methodologies of mistletoe, the precise nature, what we're trying to do, what we're trying to target, the synergism of mistletoe, but then the different delivery methods of mistletoe can be an impact and a determining factor about whether this amazing folk remedy can actually be effective. Because we can design any study, take a conventional or natural therapy, and we can design it to fail. But we need to understand the mechanisms of using these as designed for its purpose to target the tumor, to help the individual, to be a precision, individualized therapy, and mistletoe fits right in that box. Dr. LaBant, thank you for joining us on this Prescribed by Dr. Nathan Goodyear podcast. As I've said before, you didn't disappoint. You were diving deep into the science. You were, I think, dispelling some of the confusion that patients and doctors have regarding this, herbal therapy that is mistletoe. So thank you for doing that. And I look forward to having you back as a regular guest on the podcast. We'll talk more about that in the future. And so I hope you're having a great day down there. I hope you continue to help patients. I know we will stay in touch. Again, thank you for joining this podcast, Prescribed by Dr. Nathan Goodyear podcast. I encourage you to drop us a 5-star review please share the podcast with those that you think would benefit from this. So cancer, this Christmas season, share this out there. Let them understand the science of mistletoe and how they can grab a hold through wisdom, through knowledge, their healthcare, and present it to their oncologist. And maybe, who knows, bring the oncologist into this integrative arena. Share the podcast, download it, share, like, and subscribe. And as always, check us out over at pre-scribe.com, where you'll find everything, blog posts, social media. And we will see you on the next Prescribe by Dr. Nathan Goodyear podcast.
Thanks for joining us on this episode of the Prescribe Podcast. All references supporting this episode can be found on the prescribe.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.